If Congress succeeds in cutting Medicaid or Medicare, it is going to affect every single one of us because every single one of us could potentially need an emergency room. And if those things are cut, those patients don't just disappear out of the healthcare system. It means that they're not going to be going to their primary care physicians, or they're not going to be going to their specialists, and their medical conditions are going to get worse. And the one place that they will be able to go to get care is the emergency room. And I can't speak for every emergency room, but I can tell you that in the two biggest hospitals in our city, that we are still overcrowded and have been ever since things opened back up after COVID. And you may say to yourself, well, COVID is over. How is that the case? COVID is not over. I still have patients dying from it on a regular basis. I had one just this week. But let's not get sidetracked here. The things that happen to people's bodies post-COVID are making more people have to seek care this way. It was a mass disabling event, and emergency rooms have been crowded to the point that we now, in my hospital, have designated spots for the hallway beds. And this is not in some ancient facility. This emergency facility is only about 11 years old. It was designed to handle the capacity that we thought we would need, and then after COVID, the capacity increased greatly. In addition to all that, financially, it does not make sense to have people coming to the emergency room with a higher acuity for their conditions that could have been treated outside the hospital, because it's going to cost you more. It's going to cost you more because somebody's going to have to pay for those medical bills. And if they can't pay, if they were eligible for Medicaid, the state's going to have to pick that up. So you and me are going to be on the hook for those medical bills that are going to cost more because the care is more expensive to give, because they are in a worse state than they would have been if we had actually provided health care to them in a reasonable, timely manner, as we could have done with Medicare or Medicaid. And I don't know about you, but I don't like paying for things twice, and I've already paid my taxes into the fund that supplies Medicare and Medicaid to people that's supposed to be the social safety net. I don't want to be paying them to the state as well to have to fill in the gaps so that hospitals don't close down. Not only is Medicaid a net benefit to society in terms of public health, it is also a financial net benefit because it keeps us from having to pay for more expensive emergency care or just letting people die, which I know some of you are okay with. I'm not okay with that. And if you are okay with that, you're a terrible person.